I'm here today to lay out additional public health measures which we have concluded are necessary to protect our healthcare system and to save lives. As of today, we are banning all outdoor social gatherings, period. Also, effectively, immediately, we are expanding the mask mandate to apply to all indoor places and indoor workplaces throughout the province, with an exception for farm operations and people who live in rental homes. As we've said since the beginning, masks can be an effective tool in reducing transmission. The vast majority of Albertans have done the responsible thing through voluntary use of face coverings, and we see that increasingly across the province. But we are at a point where everyone has a civic duty to do their part. The following public health orders will be effective as of December 13th at 12:01 a.m. Firstly, retail services must limit their shoppers to 15% of fire code capacity, down from the current 25%. This will apply to retail stores and grocery stores, but also to shopping malls. Food court kiosks can remain open, but only for takeaway service. We will provide shopping malls with additional guidance, but the bottom line is this: malls must be limited to commercial visits by customers, not be used as a place to hang out or socialize with friends. Secondly, in-person attendance at places of worship is also being reduced to 15% of the fire code occupancy. Mandatory use of masks, physical distancing, the prohibition on related post-worship social activities, and other restrictions will continue to apply. Where they can, faith communities are encouraged to move to online or drive-in services, and these measures continue to reflect Alberta's best effort to balance enumerated constitutional rights with the critical life-saving public health imperative. All restaurants, bars, lounges, and cafes will move to takeout or delivery service only. And let me pause to say that since the most recent restrictions, the curfew, the limitation to household groups, many restaurant and similar operations have told us that they've closed because they cannot pay their own bills right now. This will allow them to fully access federal supports and provincial supports as we get through the difficult following weeks. A number of services will also be closed for the duration of these measures. That includes entertainment facilities, places like casinos, bingos, raceways, libraries, museums, theaters, and private clubs will be closed. Trade shows and conference centers will be closed. Indoor recreation facilities, including fitness centers, gyms, pools, and skating rinks, will be closed, as will personal and wellness services, which include salons, barbers, nail salons, massage, tattoo, and piercing studios. It is important to note that allied health services like physio, dentistry, social services, emergency shelters, and childcare will remain open as previously outlined. This importantly includes addiction counseling and group meetings, as well as residential addiction treatment centers. Some outdoor recreation sites may continue, such as outdoor skating rinks and ski hills. Alberta Health will work with operators to develop plans to avoid crowding and maintain safety measures. Hotels can also remain open, but will have to close pools, fitness centers, related services, and restaurants. And finally, we are announcing, and this is very important, we are announcing that all Alberta employees must work from home unless an employer requires a physical presence for operational effectiveness. This is moving from a recommendation from 2 weeks ago to a legal requirement as of this Saturday. There are no further changes to schools beyond what was announced on November 27th. So that basically means that K-6 students will remain in their classes until the Christmas break, and grades 7 to 12 will continue to work from home. Masking requirements have not changed for schools, nor has the January 11th date for resumption of in-person learning. Once again, these new restrictions are effective this coming Saturday at midnight, that is to say December 13th at 12:01 a.m., 4 days from now. This gives businesses time to prepare for an orderly adoption of these public health orders. These measures will be in effect for at least 4 weeks, and they will apply province-wide. It has always been our preference to take a regionally targeted approach. But we have concluded, regrettably, that that is not a viable option right now. In fact, 97% of Albertans live today in a local geographic area with more than 50 active COVID cases per 100,000 population, and that was our key threshold. The virus is spreading at an alarming rate in every region of the province, and many of those who fall ill in rural areas do end up being cared for in the increasingly hard-pressed large urban hospitals. So the bottom line is that we must have a coordinated province-wide approach now. 4 weeks from now, we will assess our progress, and if we can safely return to less stringent restrictions in areas of lower transmission, we'll happily do so then. Let me say a word about Christmas. For many of us, I suspect for most Albertans, Christmas is the most important time of the year. It's the symbolic heart of family life and of treasured memories. And Lord knows we all need the loving presence of family and friends at the end of this terrible year now more than ever. But here is the hard truth. Clearly, the biggest single source of viral transmission is at-home gatherings. It's when we let our guard down. It's when we relax with people that we are close to, and it's when transmission most easily happens. And so if we relax the public health measures to permit large family gatherings in just 3 weeks' time, we will, without a shadow of a doubt, see a large increase in hospitalizations and fatalities. We simply cannot let this Christmas turn into a tragedy for many families. And so with great reluctance, we are asking Albertans to limit their holiday gatherings to the members of their household or to too close contacts for people who live by themselves.
Thank you. The next question is from Sammy Hudis, Post Media. Please go ahead.
Hi, Premier Kenney. Approximately 1 month ago, you said that COVID fatalities represent, and I quote, a tiny proportion of deaths in our province. Since that day, around 300 more Albertans have died due to COVID-19. Hospitalizations, as you've noted, have risen from around 170 to well over 600, ICU admissions from 30 to over 100. We're the last province to implement the mask mandate, and you've resisted calls from health experts for months to enact the very measures that you've announced today, including saying that Alberta is doing the bare minimum a few weeks ago to help keep the economy running. So from a health perspective, it's clear that your approach hasn't worked to date and has arguably even cost people their lives. Do you acknowledge any responsibility and apologize for the way you've handled the second wave of the pandemic?
That sounds a lot more like an NDP speech than a media question, Sammy. I reject the entire premise of your question. First of all, we do lose about 26,000 people to deaths every year in Alberta. And what I said at that time is absolutely accurate. My point was to put that in context, and we've tried to keep everything in a balanced context throughout. In terms of masks, this was the first government in Canada to recommend mask usage when the Public Health Agency of Canada, the World Health Organization, and many media outlets, perhaps your own, were parodying the advice not to use masks. Alberta was calling for masks. I'll remind you as well that when the federal government was responding to pressure from the World Health Organization to keep borders open from COVID hotspots, I was calling for them as a former immigration minister to be closed, as the East Asian jurisdictions did so effectively to limit spread and have the best COVID outcomes in the world. This is the only provincial government to have provided a widespread free mask program, providing tens of millions of free masks to Albertans to normalize their usage fairly early in the pandemic period. We believe that, as I quoted 2 weeks ago from former Prime Minister Sir Wilfrid Laurier, that often the sunny ways of persuasion are more effective than the harsh means of coercion. And we have happily seen a anecdotally growing number of Albertans voluntarily embracing mask usage as a way of limiting transmission. We have wanted, as I've said from the beginning, to avoid the kind of polarized politicization of mask usage that we've seen in the United States and some other parts of the world. And so I think we've taken the right track in terms of using public education, facilitation, implementation and the earliest adoption of masks. I know that you've just joined folks who are doing drive-by smears on Alberta. I will remind you that we have had through 8 of the 9 COVID months, the lowest levels of transmission, of hospitalizations, of ICU admissions, of COVID fatalities on a per capita basis of the large Canadian provinces to this date. Quebec, Ontario, and Manitoba continue to have pretty significantly higher levels of COVID-19 related fatalities. British Columbia is just a little bit behind us. I would also point out, speaking of British Columbia, that BC, next door, with a government of a different partisan persuasion, has had a broadly very similar policy approach to Alberta, a little bit more emphasizing personal and collective responsibility, public education, as opposed to using coercive measures as the first resort. And generally, BC and Alberta have had better outcomes with respect to mortalities, hospitalizations, ICU admissions than, for example, Ontario and Quebec, which took more coercive measures more quickly. And finally, I would just put all of this in context. While we are concerned about every fatality, all 26,000 Albertans who pass away, while we're concerned about the nearly 500 Albertans who have died of opioid overdoses this year, many of which we believe parenthetically were caused indirectly by COVID restrictions that suspended the operation of residential treatment centres and by other policy responses like the CERB payments to people coping with addiction. While all of those fatalities, whether opioid-related, COVID-19-related, or other suicide-related, they're all tragedies in and of themselves. We should acknowledge that, for example, you can take California, a state that has been celebrated as a lockdown state, which has encountered 278 deaths per million, hospitalizations per million compared to 137 in Alberta. And California's encountered 50 deaths per million as opposed to 14.5 in Alberta. I could run you through a comparative statistical analysis of our outcomes versus those of jurisdictions that have taken much more stringent measures. At the end of the day, we've tried to do this in a balanced way, and now it's up to Albertans to rise to the challenge during this critically important time.